Hill Country's mission is, with kindness, we partner with our patients, providing the healthcare services for them to live whole, healthy, and satisfying lives.
We are the only clinic around for a 30-minute drive in most directions, and being able to provide that for this community up here is really something special.
I've always felt that you feel better if your neighbors and everybody's taking care of you than somebody that you've never met before.
Thankfully, we have a special place like this up in the mountains that most of these mountain towns can go to.
All of those goals about our health, about our well-being as a community, we're not going to get there, in my opinion, without Hill Country.
Hill Country Clinic is a federally qualified health center in Northern California. We also are a certified community behavioral health clinic. Mostly, I think we're a center for our patients in the area to get whole patient care. So we don't just do medical, we do dental, behavioral health, chiro, psych. We have a teen center, we have a radio station, and we try to be a place where the community can both utilize and work on being healthy.
Hill Country was founded by 4 friends. Interestingly, one of those friends was a physician, another friend was a therapist. That's how integrated care really started. The idea of that clinic was, how do we bring healthcare to this really sort of remote space in Shasta County?
In '82, we became a nonprofit, and we began, and the first months, there was no pay for anybody. It was all volunteer. We started out famously fundraising by doing ravioli dinners at the community center and things like that.
We were the little clinic on the hill that could, and we just responded to the need that was in front of us. Although we're not just in Round Mountain anymore, that's still the drives what we do, because it's about how do we get people the services that they need. This clinic has not been without struggle. We have recently just had a really significant financial struggle where I had days since I've become CEO where I wasn't really sure that we would keep the doors open, and yet was really worried about who's going to stand in this space if our doors aren't open.
Hill Country is not new to challenges. And what has made it succeed is its ability to pivot and its ability to be creative. What do we have to do to make this work? Okay, let's rethink how we do this.
I think that that's what makes us good at what we do, and our ability to empathize with the people that we serve, because we understand struggle.
So the Care Center is first and foremost an urgent mental health center. So at its core, we provide urgent mental health interventions for people that are experiencing some sort of mental health crisis, whether that be suicidality or just, grief and loss, or, going through a breakup. Anything can be a crisis. And then beyond that, we have a team of case managers that helps people get connected to resources throughout the community so that they don't find themselves in crisis again.
Because they have the care center and it's open every day, that's an added resource for our patients, particularly our patients who are homeless or mentally ill or suffering from addiction.
We serve everybody. Our doors open for all folks. So we see people from all walks of life, all socioeconomic backgrounds.
We have a terrific need in Shasta County. We have 40% of the people that live here are at or below poverty, so we definitely have a need. We have people with high levels of trauma, unique in Shasta County.
Hill Country is a small clinic, but at all levels in the county and in the city, other organizations are utilizing our services, particularly our Mobile Crisis Outreach Team, MCOT.
The Mobile Crisis Outreach Team really came from a group of folks at Hill Country seeing the current response to mental health crisis in our community, and seeing that law enforcement maybe isn't always the best option to support folks that are really having a mental health issue, and wanting to provide a more consistent, compassionate, supportive response to folks having those needs, while also alleviating the burden on law enforcement officers in our EMS system, with really a focus on being able to respond rapidly, to have a mental health professional who can assess what's going on, who can follow up with that family or that individual in the community to really help them get connected moving forward to hopefully prevent those crisis situations from happening again.
If you can help people who are in crisis get from a 10 to an 8, a lot of times they actually start to solve their own problems and they don't really need me that much anymore.
The dental space in particular really prides itself on creating an environment where patients can come in, we can ease into a care plan, because we know that there's fears associated with dentistry.
In dentistry, it's not just the teeth we work on, it's the people. You know, the tooth is connected to a heart, and we want to make sure that we fulfill that heart as much as possible. When your smile looks good, you feel good. When you have tooth pain, it definitely puts a damper on your behavior as well.
So when I think about the long-term sustainability of this clinic, one of the things that I realize in all of the struggles that we've had in the last 40 years, we will always continue to fight to be here, but the only way we will do it is what we've done the last 40 years, which is dependent on our community to help us to get there. And whether that's people who just every month make a donation and they just contribute to this. Sometimes it's people say, what's the big project you have going on? And they want to be a part of a big project or a big capital campaign. We haven't made it 40 years without our partnership with this community. We will not make it the next 40 years without hand in hand doing this work really together with this community.
I think that we are on an upward path. We have done the hard stuff. You know, we've turned our organization around. We are restructuring. Now we're working on the fun stuff.
So now having people in the right places, in the right positions, what can we do with this? I think at the heart will always be community focused, especially for this initial population up here, but it's really all of Shasta County and how can we help the people the most.